Gentlemen, we're back again to our presentation of webinars, and with us Dr. Ali Ramazanoglu from ROMATEM Physical Therapy and Rehabilitation Hospital, which is one of the leading hospitals for rehabilitation and physiotherapy, and they have many cities where they are serving international and Turkish citizen patients in regard of physical therapy and rehabilitations. And Dr. Ali Ramazanoglu will going to share with us all services and treatment they are providing for their international patients in their hospitals. Dr. Ali, the floor is yours. Please, after presentation, keep with us that we can have some question from the audience. Go ahead, please. You can share your screen.
Thank you so much. Hello, first of all, I would like to say thanks for everyone to be part from this event. As ROMATEM Hospital, it's my pleasure to be with you today. I will share my presentation now. First of all, I would like to start with the difference between physical therapy and rehabilitation. When we think about physical therapy, many people are not aware of all the different therapies and treatments that includes. Here, the therapies used for treatment are going to help improve your quality of life by restoring your body natural function. The injuries or illness treated could be affecting your joints, muscle, tendon, or ligaments, bones, or spinal cord injury. So, physical situation of your body, but your mental and state as well. It should be also noted that treatments may affect by age, especially for pediatric or geriatric patients. For ROMATEM, we are available in Bursa, and we are also in Kocaeli, in Samsun, and we have a clinic for outpatient in Fulya, Istanbul, and also in Baku for outpatient. I will start with the first hospital in Samsun. We opened our Samsun July 2005, and now we are available in Kocaeli and Samsun and Bursa and Istanbul. ROMATEM Bursa with 50 beds capacity, it's the biggest one. And here I can say that in Bursa we have one of the best hospitals in the world, which contain the latest technology equipments in field of rehabilitation, with the total bed capacity 35. In Samsun we have 21 bed, all of this for inpatients. That's our service there. As I told you in full. So in our hospital, we provide several category of services. I will start with the first one, which is neurological rehabilitation. The nervous system, such as paralysis resulting from cerebral hemorrhage or a head trauma, stroke, brain tumor, spinal cord injuries, and various neurological diseases such as multiple sclerosis. Treatment of nervous injuries, which may occur in arms and legs and nerves interdependence, such as carpal tunnel syndrome. For this kind of injury, we apply neurological rehabilitation program that aims to restore patient activity to the maximum level. The second one, orthopedic rehabilitation. We apply this kind of program to restore normal movements and functional to the joint. And it's used to treat orthopedic problems such as fracture, or after surgery, by the way, in general, we can say that. Dislocation and ligament injury, meniscus or ligament tear as example. or following surgical intervention or arthroscopy to joints such as shoulder pain or knee or hip. Here we can talk about pediatric rehabilitation, which is the most, in general, if I want to say about the cases which has come from Russian or these countries, we have a lot of palsy patients for family and child. However, the child can have more independent life following rehabilitation treatment based on scientific and well-planned approach. Athlete health or sport injury or physical recovery, as I say about that. Physical therapy can be used to treat sports injury leading the deficiency in joints functions like fracture, meniscus, or separate ligaments, limitation in range of motion for the joints. Now I will start to talk about the robotic rehabilitation equipments. By the way, in one hospital, you can find one or two or more than that robots in one hospital for rehabilitation, but I will start now to talk about this kind of machine. I will start with Andago, safe and free overground gait training. So it's free overground walking physiological training, upright and hand-free, which is weight support. The patient can walk naturally. So we can say that this robot is intensive and overground daily life training. The second one, conventional therapy, effective functional gait therapy, motor learning, training intensity. The most important point for robots in depth after very famous robot. I would like to explain that there is very important point about this device. It's very important for neurological cases. It should be less than 105 kilograms for the patient. The maximum for this device can take patient with 105 kilogram at maximum. Now, with hand robot, which working for finger methods. Arm power is very important for stroke rehabilitation. So after stroke rehabilitation, we use for shoulder and arm. Rehabilitation because patient have ergo, or I like to say here, early stage rehabilitation. Ergo for lower limb rehabilitation, we use it for early stage rehabilitation before locomat. So the patient came with the spinal cord injury, he can't move his limbs or legs. We use this kind as the first choice for us. Now, I will complete with Exoskeleton. Exoskeleton is wearable walking robot which leads to the improvements of health in general. By the way, we can't use this kind of treatment for all the patients. Like quadriplegia, we can't use it because we need some power in our limb. That's why we used just for paralysis patients. Now I will talk about DRX 9000C. It's a spinal decompression system. It's non-surgical. This device will check the MR or reports for patients, and here there is a small we can press here for the local one, and by this way, the nerve will be free. That's our goal. So with this machine, we don't need any surgical treatment. For sure, it's not suitable for all the patients. As you know, hernia, there is stage 1 or 2, 3, and 4. 1 or 2, we can solve it with physical therapy. 3, maybe we can solve it with physical therapy. Maybe we will need surgical. 4, sure, we should make surgical treatments. Hydrotherapy or swimming pool, it's very important for balance. So it's useful for balance. Patients who can't bear loads on their joints can exercise with less pain and more activity due to the support power of water. Manual therapy. I know here I'm not talking about any kind of equipment, but for me it's the most important part of physical therapy. Manual therapy used by physiotherapists without any equipment. The physiotherapists try here to focus about musculoskeletal system, pain and disability by working about muscle joint manipulation and mobilization. In our hospital, we have like 29% from our patients came from Middle East, which is Iraq or Libya or Lebanon or Algeria. From Europe, we have 15% came from Germany and Belgium. In Gulf country, 20% from our patient came from Qatar, Saudi Arabia, or Kuwait. In Ukraine and Azerbaijan, Kazakhstan, and Russia, we have like 30% from patients who came from these countries. In our services, we have VIP transportation from and to the airport. And there is accommodation, as I told you, in Kojeli and Samsun and Bursa. There is follow-up care, sure, and there is nurse services. We are working with the best doctors in this field, and they have a very long experience. Here is the simple physiotherapy treatment: rheumatologic rehabilitation, cardiac rehabilitation. Cardiac rehabilitation, we use the same program as neurologic, but we should have take care about some points about pressure for the patient, or blood pressure of the patient, or if he has diabetes or no, diabetic mellitus or no. Therasuit, which is a special method for cerebral palsy. We used for a child who has cerebral palsy. Ozone therapy is very important nowadays because we are working for that. They said it's very useful for immunity system, especially at Corona. Everyone is looking for something special. Occupational therapy, hand therapy, foot analysis, scoliosis treatment. Scoliosis treatment, here I would like to explain one point about scoliosis. Scoliosis, it's depend about degree. If it's less than 15, we can solve it by physical therapy. But more than that, I think we will need surgery. Lymphodeme treatment, acupuncture, reflexology massage, bandage and heel therapy, and shockwave therapy. Here, I will say that this is simple kind of physical therapy, but it's very important. For sure, I talked about technology. It's important, but we can't say that we will not use this kind of treatments. Thank you so much, and I'm ready if you need to ask any question.
Thank you, Dr. Ali. If you can stop your screen sharing, that we can able to ask the questions. I cannot see you now. Yes, I can see you. Thank you for the presentation and for all the informative information that you have shared about ROMATEM. We know that ROMATEM also one of the leading physiotherapy and rehabilitation centers for Turkey, and they have in so many cities hospitals, patient and outpatient hospitals. And also, I know that you have kind of international affiliation activities as well, like in Azerbaijan, in some other countries as well. Have you mentioned in your presentation already?
Yeah, we have a branch in Baku. Yeah. At the first page, I said that we are available in Bursa, Samsun, Kocaeli, and Istanbul, and we have a branch in Baku, in Azerbaijan. And to be sure from that, we have two small clinics in Baku.
Yes. Are you ready to expand your availability in CIS market? Because as far as I see from your presentation, that 30% is your majority of your patient coming from CIS market.
Yeah.
Exactly today's market where we are talking to 13 countries.
Yeah. Our goal actually to make a new branch in all the world, because we are working to make ROMATEM the best hospital for rehabilitation. We are just specialized by physical therapy and rehabilitation. That's why we are looking to make a new branch in Ukraine, in Russia. We are available for that all the time.
Any local partner, potential partner to be partnered together, it's possible for ROMATEM to expand together or to invest together.
Sure, we are available for everything, and I think some news. Maybe we will. There is a small project in Ukraine, in Kiev. Maybe we will make it with some doctors there. We hope that. We know it's very important for us.
That's great. Thank you very much for joining us, and we are hoping to see you in our next events. Most probably in 2 months' time, we are willing to organize again the second one, and hopefully your organization benefit from this events in B2Bs and also in the presentation of your organization to the audience. There's a lot of good comments. Many doctors and facilitator, travel agent has commented that they have referred many patients to ROMATEM, and happily all the patients come with very high satisfaction. So thank you for that. I can see those comments here.
Actually, we have to say thanks for you.